Hi, this is Dr. Ferguson, as part of our series on pain and inflammation, we wanted to make sure you heard about gabapentin. And this is a drug that is being used primarily in small animals, a little bit in horses, and we'll talk about the key aspects of this product so you can understand when somebody brings it up in the context of managing particularly chronic pain. So it's first important to mention that this is an extra label use of gabapentin. Its major use is also as an anticonvulsant. We'll talk about that a little bit in the next slide or so. This is the structure of gabapentin, and we'll point out how similar it is to the neurotransmitter gamma-aminobutyric acid, GABA. So we use it primarily for chronic pain, particularly neuropathic pain. That's a topic that is a type of pain that can be associated with, it's also chronic pain, but it's associated with damage in and around nerves. And it's particularly been used in dogs, but there's some anecdotal evidence of benefit in cats and even horses. It's not of great benefit for acute pain, but may have value when used preemptively to a surgical procedure, and has been shown actually to reduce the requirement for the amount of other analgesics such as the opioids perioperatively. So how does gabapentin work? Well, you can see up here that there's a structure and a very similar structure to the gamma-aminobutyric acid, which is a neurotransmitter known as an inhibitory neurotransmitter because it's associated with the chloride channel and increases chloride flux that tends to reduce the excitability of neurons. Having said all that, even though it is structurally related to GABA, it does not appear to be a GABA agonist. Another compound that is a GABA agonist is diazepam, or the benzodiazepines, and it doesn't alter the binding, reuptake, or degradation of GABA. So some of its mechanism of action is a bit of a mystery. Nonetheless, it has analgesic effects and prevents allodynia, which is the sensation of pain resulting from a normally non-noxious stimulus. That is it also can be equated with hyperalgesia, which is an exaggerated response to painful stimuli. So you can, if you think of patients that have had an injury and they are constantly in pain of various types, various severity, etc., and there's not always a known cause for that pain, gabapentin is one of these drugs that has been applied in that situation. And in many cases in human medicine, it's applied very effectively. It's also known to be anticonvulsant. That may or may not be associated with its similarity to GABA. It's known to bind mechanistically to voltage-gated calcium channels, decreasing the calcium influx, and then reducing the release of excitatory neurotransmitters such as substance P, glutamate, and norepinephrine. And so through this mechanism, it's still pretty vague, but through this mechanism, it seems to be able to calm down nervous transmission. Just a little bit about the pharmacokinetics and how we administer the drug, because there's an important caution here. First of all, it's very well absorbed in the dog and even better in the cat, 80% in the dog, 90-95% in the cat. And we need to make a note here that, and I mentioned it again, that's how important it is to not use the human product for a dog because it includes the sugar, that xylitol, which is known for causing toxicity in dogs, particularly renal toxicity. and this is why chewing gum is not a good idea for dogs. Gabapentin basically is eliminated by the kidney following metabolism, and in a dog and a cat we have a half-life of, fairly short half-life of 2 to 4 hours. And so the final thing I wanted to talk about were the adverse effects. Obviously, sedation and ataxia can be seen. There can be some GI side effects, hypersalivation and vomiting, but this seems to go away over time or with reduced dose. And as I mentioned before, do not use Neurontin, which is the oral human product, because it contains xylitol. It's a problem in dogs, not felt to be as much of a problem in cats, but it's not a bad idea to avoid its use in any animal species. Use the veterinary products when you want to use gabapentin. And so that's all I had to say about gabapentin. I really want to just give you a big picture view of where it fits in and why you may be hearing about it in the context of managing particularly chronic pain in domestic animals.